Hello again, Dr. Gillard here. This is part two of our series on how to, well, in part one, let me explain. Part one, we reviewed the key anatomical structures of the lumbar spine in preparation to look and see what those anatomical structures look like on MRI. And to go a step further, I have videos on how to read your MRIs, but I never made one on how to actually use ONUS 2.5. And this is exactly what I do. If you signed up from a coaching service and I've instructed you to come to this video, this is exactly what I do in the video. So step one is to go to the internet, download ONUS 2.5 for free. I think you have to put in your email or something, but it's completely free download. For those of you who use a Mac, you are out of luck because this is only a Windows program. And there's one called Osirix for Mac, but I'm not a Mac guy, so I don't really know what to tell you. It's the same basic principle. You're going to split the screen and get the cut line out and everything. But for PC people, here we go. Step one, double click ONUS 2.5. This is going to open it up. Notice my two MRIs up here. So I actually copied the files off the CD-ROM and dumped them into files here. See what they look like? There's the files right off the CD. And that's a much more convenient way than carrying those clunky CDs around. Now I have another MRI on this channel called how to upload your, or another video on this channel called how to upload your MRI images. And you can watch that and I show you, even if you don't know hardly anything about PCs, I take you very slowly how to take your images off your MRI, put them in a folder, zip the folder, and upload those to me. So you can watch that. All right, now this is open. Now we have to go find the images we want to import. So now if you have a CD and you put it in your CD-ROM, it'll pop up over here. All you would do is just click on it one time and your images would pop up. But mine are off the CD in a file form, so don't go here. Go to Import from a directory. Okay, and let's close this up. So here's the desktop tree, and you just have to find where you put them. I put mine right on the desktop. So here's my desktop stuff. And here's my MRI images. Let's use my contrast enhance. This is probably the best one I have, 2014. All right, click OK, and here they come. Not all the files will open. Some of them will fail. Probably half of them usually fail. So 53 failed, but that's fine. That's stuff that all we need is the DICOM based images, which you don't need to know. Okay, now, so my birth date, I guess I better block that out, but you can choose to remove this stuff if you want. So next step is to just click on this. Okay, and there's my images. Okay, they're ready to go. So now I'm in the database. Let's go to the viewer. I don't have to click anything. All I got to do is double click on any one of these images. It pops it up in the viewer. So my student should know what that is. That's what type of image? It's an A to P image. Psoas muscles, kidneys there, just a real rough kind of draft here to see scoliosis, not little tiny curvature, but that's completely normal. All right, so step one. Step two is I want you to go up here and split the screen. And let me back up for a second. I noticed just to make sure, you see this beautiful menu I have here, all the tools are up. When you go to view, make sure show toolbar. If that's not ticked, you can have this little mini toolbar here. It's really hard to fool around with that. It's better to go to view, show the toolbar, and then you're all set. All right, now we got to view these things, you have to have two screens. So go up here, click view, split the current view. Okay, so now I have another screen over here. Now the trick is to load your sagittal images over on this side, your axial images on this side, and when you do, a magical orange cut line appears, which is wonderful. Okay, next step, we don't need 4 images up here, so double click on any one of these you want. Double left click, that pulls up a single view. And now let's go find the sagittals, usually the first one down. There's 4 again, just double click to make it 1. Now, how do we scroll between these? There's 14 slices. So my lumbar spine, not like an x-ray. When x-ray is like you've been run over by a steamroller, you have one image of everything smashed together. But now we have 14 literal slices, like if they threw me in a meat slicer and cut me up into 14 pieces, we can look at the different slices. So how do you access those? Just use your up and down arrow keys on your keyboard, and you can go right through these. Or you can use your mouse to scroll. Some mouses you can just use your little scroll bar to go up and down. I like the arrow keys. Okay, and now watch. Well, let's fix the color. You go, oh, it's too dark. It's too dark. Let's brighten it up. Let's go up to our tools. I have the arrow tool out right now, but let's go over the. Oh, let me take my information off too, because I'll probably have to have a big block thing going on. So if you want to remove your images, well, I got to do it anyway, but I'll take it off right now. No, let me leave it up. Sorry. Um, So let's go to this funny looking bent line, and that's your contrast. So if you do draw a backwards C, you can get some really nice, assuming you've had it, this is a beautiful 3 Tesla MRI here. So these are very nice images. Always send your patients for a 3 Tesla MRI. Make sure they use the 3 Tesla to actually take good images. It shouldn't take 20 minutes. It should take about an hour for these. You'll get some beautiful images with 3 Tesla. Okay, so that's a good contrast. Now, watch in here as I find the AXO images over here. So let's look down. This looks like an AXO image, 38 images here. So when I click on this, an orange line is going to magically, I don't have to do anything. See how it popped up? That's the cut line. 4 images, I just need 1, so double click. Okay, now we have, I'll do my backwards C to get the color up. And there, I have a from the side view called a sagittal view and an axial view from the top. And these are actually T2 weighted images. How do I know the T2, students? Cerebral spinal fluid's bright white. My discs are also generated. You can't really see. Well, there's one kind of good one up there. But if the discs are degenerated, you might say, oh, this is a T1 image, but look at the cerebral spinal fluid. Anything with water, inflammation, anything glows bright white on a T2 image. Let's also blow this up a little. Let's kind of bring this up, and so we can start to see things a little better. Same thing over here. Let's blow this up. This is way too small. Let's get it big. And we'll go through the T1 and add them here in a second. Before I do that, let's do the difference between T1 and T2 here. Let me scroll up and see how that works. So as I scroll up and down, oh, did they jumped over the? I hate when they do that. See, they didn't cut right through the bodies. See the line jump? They just cut through the disc. Laziness. There's a cut through the disc. Let's look at the disc real quick. Okay, students. Well, no. Let me just teach. This is not gonna be a quiz. And if I want to make this a little bit bigger, hit this button right here. This closes the little menu with all the images. We don't need those right now. All right. So here's the deal. For coaching clients, this is the part that will save us time during the coaching session. So this is a picture of you from the side. This is your belly. This is the front of you. This is the back of you. See these things right here? Those are the little bumps you can feel in the midline of your back running down. Perfect example, if you take your fingers, slide your fingers off the back of your head down to where your neck meets your shoulder, you'll feel some really big bumps there. Those are these things. They're called spinous processes. If you were to wear a belt, your belt would run right through here, the L5 vertebra. All right? So now here is, the spine is like a tower, and the base of the tower is here. This is called the sacrum. By the way, I have my little hand tool out now. See the hand tool? I can slide this all over the place. So this is the base of the spine, and you have blocks called vertebrae that stack off on top of the sacrum. And so this would be L5, L4, L3. L stands for lumbar. L2, L1. This would be T12. That's T11, so I got a bonus. I got a couple thoracic in here. So there's 5 lumbar vertebrae. Now between the vertebrae sits the intervertebral disc. So this is a cartilaginous type pad. It has a jello toothpaste like material in the center, which you can't see here, and then it's surrounded by the annulus fibrosus. So really it's like the tread of a tire, but instead of air in the center, you have this toothpaste material. You have tremendous weight pushing down on this disc from the weight of gravity and the weight of your body. And if this was all made of toothpaste, it would squirt all over the place. Luckily, it's corralled in place by the annulus fibrosus. And from part 1 of the video, you should know exactly what I'm talking about. So as long as that material is corralled in the middle, you're okay. If the tread of the tire or the annulus fibrosus rips, that toothpaste can squirt right out the back, and that's a herniation. Now, this is the L3 disc. How do we know that? Because whatever vertebrae sits on top of the disc conquers it. So the L3 vertebrae conquers the L4 disc, or L3 disc. This is L4. This is L5. Got it? L2, L1. Okay. Now, where's the posterior arch here? I know you're thinking, God, well, where's that darn posterior arch? Well, we're in between. We're right. This is a mid-sagittal cut. You can see the cerebral spinal fluid here. You can even see the traversing nerve roots. See these things? These dark strings? That's the cauda equina. This is all the cauda equina. Traversing nerve roots are starting to come out, heading for the pedicle to go out the IVF. So how can I prove that I'm right in the middle here? Let's put a cut through over here. What is this over here anyway? Well, whatever this orange cut line cuts through is what we're looking at. If I had an eraser and I could erase everything above here perfectly, except for this cut line, kind of like sawing down a tree and looking at the trunk, this is what I'd see. This is the trunk of the tree. In this case, it's the disc because I have a cut going right through the disc. Then it's going right through the thecal sac, right? And here it is over here. Let me change the contrast maybe and tone that down a little bit so we can see things a little bit better. Okay, now how do I prove it's a mid-sagittal cut? This is a cut right between these pedicles. If I was cut through here, we'd see the pedicles. In fact, you can't see the pedicles. Why can't you see the pedicles here? Because we're cut through the IVFs. This is the intervertebral foramen here. Watch, if I go over here and I left click anywhere on the sagittal, and now I use my up and down arrow, see the cut line changes. See, I'm right in the center here. This is off a few millimeters. It's not perfectly lined up, it looks like, because that's mid-sagittal right there. So this is off by about 2 millimeters. That should be, orange line should be right there, which is common. Okay, what if I want to look at the IVFs? Okay, I'm still through the disc. I need a disc level cut to look at the IVFs. On the overhead I do, but not on the sagittal. So here's a cut through the start of the IVF at L3, and there's the IVF right there. Looks like a light bulb. What's that thing? Well, nerve, but more specific. Which nerve? It's the there's the L3 vertebrae, L3 disc. That's the L3 exiting nerve root. Got it? Very important, 8th quarter students. L3 exiting nerve root. What's that little thing right there? That's a radicular artery. Okay, ligamentum flavum on me is normal, but that's that black thing right back there. It makes up the anterior part of the facet joint. See it right here? When you get in class, you're going to see one that are about 20 times bigger. Some people have ligamentum flavums that are so big they smash the thecal sac up. Luckily, knock on wood, mine's probably good for life. I don't think that'll ever cause me trouble. All right, what's this thing right here? Well, there's another one down here. What makes up the roof and the floor of the IVF? That's the pedicle. The pedicle of who? Pedicle of L3. Okay, well, how come I don't see it here? Where is it? Because we have a disc level cut here. You want to go see it? I don't know if we can see it. Did they skip over this? I think they skipped over it. Let's see. Let's see if we luck out. We can just barely see it there. See it coming through. If I put a cut right through it, if these lazy people would have put one right through there, I could have seen better. But anyway, you can kind of get the idea. Let's see if I can see one up here. I want to show you a pedicle. There's better. That's better. See, I got a cut right through that part of the pedicle. And there it is. Pedicle. What's this? Vertebral body, pedicle, and this is the facet. Part of the facet there, spinous process. What are these things? We're up pretty high, so it's just the beginning of the psoas major muscle. Abdominal aorta is there. Vena cava is over here coming down. These, I believe, are actually the crura. Are those the crura still? Can't remember if those are crura. But that's vena cava, that's aorta. How about this? Because you know what that is. Quadratus lumborum muscle. This one. Multifidi. Yep, and then we got the semispinalis. Semispinalis is here. Longissimus thoracis. And spinalis thoracis would be right in here as well. Okay, so we got that taken care of. What else do I need to show you? Let's take a look at these things right here. Now what's going on? So we get a cut up here through L5, 4, 3, 2, through 2. Name the parts. So if this is L2 disc, it's being conquered it because L2 bone sits on top of it. This is the superior articular process from L3. This is coming up from below. This is the posterior arch. So this is the inferior articular process of L3. Where are we? I forgot. 5, 4, 3, 2. So this is all 2 stuff, except for this, superior articular process of L3. Inferior articular process of L2. Lamina of L2. Spinous of L2. Ligamentum flavum is that black thing right there. You can see the thecal sac members. Who's this pair right here? See those two? There's a sensory nerve root. And the T1, this would just be one big root. Well, if this is L2, this is the L3 traversing nerve root. And who are these guys out here? It's a double, looks like, out there. Those are the exiting L2 nerve roots. Exiting L2 nerve roots over here. These are the ones that come out the hole. By the way, this is left, this is right over here. Images are reversed because we're really not looking down, we're looking up. So we're looking up, so this is the left-hand side. Okay, got it? Let's go down, see what else we can see. Now this is interesting. Okay, 8th quarter students, I don't know if you've had this, or if you're an older student, you're going, oh my God, I see a problem. See it, students? Coaching people, I don't think you know what this is yet. Well, look, here's the disc. You can actually see a little nucleus in L3. Still got some life in it, but there's something really big right there. HIZ. So if I discography, I probably got a nice, either an annular tear through here, or I got a concentric tear. That's part of the reason. This is on the left side. This can refer pain down to the left thigh. So that's probably when I get back pain, I get pain referred to my left anterolateral thigh. It's probably because of that thing. You got to be careful with those though, because there's plenty of people walking around with those things and they don't have any pain. So got to be. That's why you can't, you just can't look at an MRI or an X-ray or CT and say, oh, I know what's wrong with this patient. There's false positive rate on all of this stuff except for a disc extrusion sequestration. Well, even on them, it's rare, but you can still have a false positive. That's why you got to get the history, the patient history. Got to find out what happened, know something about the history. Then you got to know something about the neurological findings. And then you look at the images. You piece all things together, and that's how you make a diagnosis of somebody. So big fat annular tear there. I don't want to make this too long though. I just wanted to get you up to speed in anatomy. So there's one. We're just seeing the facet joints here. I go down a couple cuts. Now you can see the IVFs. See how nice those IVFs are? And you can see so we're at L4, inferior end plate of L4, name these structures. So I said the nerve roots are inside the thecal sac at L4, so who are these? Those are the traversing L5 nerve roots. They're going to look like this when I go down. If these lame people would have put a cut through every single layer like they're supposed to, we could actually watch them being born. But they didn't. Don't get me started. Okay, so L4, these are L4 exiting nerve roots. These are the traversing L5 nerve roots. Right? Did I say that right? L5 traversing nerve roots, exiting L4 nerve roots. Who are these? Right there. Well, they're the next one in line. These are S1. These are traversing S1 nerve roots. Who's that? There's one that goes to your bladder. That's the traversing L3 nerve root. And the other one's kind of didn't come out very good there. It might be pulsating. Remember, this stuff is all pulsating. Cerebrospinal fluid is like a river flowing through here. When stuff moves around, it doesn't show up good. Okay, so that's nice. IVFs are wide open. I don't see any bone spurs. A lot of fat in these multifidi muscle. I definitely could use a spinal stabilization program, which I don't have time for. Actually, swimming would be the best thing, which I don't have time for. Okay, now, so keep this in your memory banks, the size of those traversing nerve roots. I'll show you one bit of pathology and I think we'll call it a day. Because I'm not going to teach you how to read a contrast. It's probably beyond the scope of this. There's L4. Let's go down and look at L5. What's the first thing you notice about L5? I'm pretty darn skinny, aren't I? So pretty bad degenerative disc disease. That disc is pretty much shot. Here, who's this right here? L5 exiting root? No, that's L4. L4 exiting, L3 exiting root, L4. L5 is right here. Who's this guy? That's the S1 exiting root. He doesn't go out of IVF. Well, he does, but he goes out through the sacral IVF, and then he's going to pop out the anterior sacral foramen here. So you actually can see that there as well. I forgot what I was going to say though. Oh, let's keep an eye on the S1 root. Let me put this back in the center. I'll show you one bit of pathology. My nemesis. Okay, so let's go. Remember patient history, failed discectomy in 2003. I was unable to work for 6 months. And no, I didn't have disability insurance. I ate it. I couldn't work. Had to use savings account money. Okay, let's go down. Now, right through. Okay, so we're through the L5 disc. Okay, who's that? That's the right S1 traversing root. Who's that? That's the exiting L5 root on the right. Now, what's going on? Well, let's do that one. There's the left L5 exiting root. That one's okay. What's going on here? Let's blow that up. Keep an eye on that. Wait till I'll show you it on the T1. So remember I had a surgery here. So the surgeon went in there, was monkeying around with that nerve root. Can I watch what happens? Look at this picture right here. Where is the nerve root? Yikes, it's right here, but what's all this stuff? It's scar tissue. That's scar tissue from the surgery. Some people scar. Some people believe the surgeon got too rough. Maybe slipped. Who knows? Some people, surgeons do a good job, but people just scar. Sometimes it just happens. We'll never know, but it sure was a miserable failure. Okay, now let's go over and look at this thing. Let's blow this up. Students, T1 or T2? Let's close this off. Now, T1, right? No cerebrospinal fluid. So this is let me go down. I don't have my cut line now. Oops, looks like down is up on these arrows. Go right down to the bottom. There's sacrum, base of the sacrum. So there's the L5 disc they didn't get a great cut through this. See, you can still, I bet you, well, I won't do it now, but they didn't get a cut down the disc. Not as good as this, but that was kind of hard to get a cut down a disc that small. So now look at the difference here. This is the T1 weighted image. So you can see the scarring right in here. And it's like, what is all this stuff? Is that now the question is that a new herniation? I had a lot of pain when this was taken, a lot of back pain and leg pain. So the question is, was that a new disc herniation? So to answer that, I said I wasn't going to do this, but I guess I'll do it. To answer that, you do a gadolinium study. And let's see if we can find the gadolinium image and put it over here. Gadoliniums, you always look on the T1 weighted images. And gadolinium lights up, if this is scar tissue, and it only works about 70% of the time or so. Sometimes it just doesn't work, but 70, 75, maybe 80 at the most, somewhere around there. If this is still filled with blood vessels, the gadolinium will turn this all white, and it basically will look like this, and it's like it disappears. If this is a new disc herniation and it hasn't vascularized, it'll be black. So when you go to the gadolinium, it'll still look black, and that's an indication that you've had a recurrent disc herniation. So that's what we have to find out here. So let's see if this is the plus or not. It looks like GD. See it up there? GD. I might have this blocked out. My birth date's around there somewhere. That's gadolinium. So we're good. Now let's go and see. Let's take it up. And there's the image. And that looks like the same image though. But it says gadolinium. No, I guess that's about the best you can get. So it whitened some of the tissue. Looks a little bit better there. Let me see if I got a better one. No, I guess that was it. That was the best I had. I seem to remember it disappearing more, but I might have got that confused with a client. Now this is just the regular old. See, this is the T1 weighted. So yeah, that was the best that we had. So it didn't really work that good on me. Because it still looks pretty. It wasn't a herniation though. It settled down. See that little bone spur though? Look at that spur growing right into the mix here. It's a little bit lateral, luckily, to that nerve root. So I don't know. Does that look any better to you? Looks a little bit better to me, but not really. There's that thing right there. But it wasn't thought to be a herniation because the leg pain, it was just a bad flare up and it went away. But anyway, that's a gadolinium trick that really didn't work very well. All right, I think that's about all I wanted to show you. So you could probably take off now. Let's throw, for those of you who want to hang around for a second, let's see if I got some T1. Let's go through these real quick. This should be T1 weighted. Is it T1 or no? Yes, T1 weighted images, because you don't see the cerebrospinal fluid anymore. Right, so now let's get a gadolinium here. Should be GD for gadolinium. Usually these, if you've had gadolinium, it's rare. This is kind of their own little weird system, GD. It usually says C+, and that means contrast if you see C+ here. Okay. Now let's see if we can see that scar tissue on this view here. There's the S1. See the S1 nerve root right there? See it? See it go down? Someone has a problem with the S1 nerve root. You follow it right up. See how it... Now, I'm missing a cut there. It's right here. See how it misses the disc? There's no problem. Now watch when I go to the other side. Let's follow that one up. This is my bad one. So there's your S1. See if we got a nice... Yeah, it still looks like it's missing. I mean, it's definitely closer than the other side. So let's see if we can see, because it looks like a mess here. It almost looks like a new herniation there, small one. But let's see if we can, the gadolinium trick worked. It probably won't work over here either. But let's try it. Some of my clients, you go through these, it's miraculous. It just, they have really thick scar tissue in it. Just completely disappears. Let's see, so there's the nerve root. I don't think that's, I think it's this side. Here it is right here. Yeah, maybe cleaned it up a little bit. It's about the same as the other one. So that, yeah, I cleaned it up a bit, but not much. So I don't see a herniation though. To me, it looked like a herniation here, so maybe it did clean it up more. But that's the gadolinium trick. And like I said, probably about 70% of the time it works. The other percent of the time you really can't see. Okay, I think that's good enough. So you guys should be ready for the 8th quarter class, and you other people should be ready for the coaching session. And look forward to seeing you all in the next video. Bye bye.